Hey everyone, this is Dr. Monica Du, a board-certified pediatrician, wife, and mom, and in today's video, we are talking all about fever. I know that many of us as moms may have faced those unpredictable nights when our infant or our child has a high temperature, very hot body temperature, and we may have been worried and concerned and not knowing what we should do. In today's video, I'm going to be talking all about fever, what you should be aware of, and some tips that you should keep in mind if ever your infant or child were to have a fever, so that you know when you should be taking steps to do things that you can at home and when it can be a serious concern and when you should seek that medical attention. So first, fever by definition is a temperature of 100.4 degrees Fahrenheit or 38 degrees Celsius, ideally taken by the rectum, especially in babies and infants, so that you can get an accurate temperature. Now, infants are those that are under 12 months old. So in those cases, it would be a good idea to go ahead and get your rectal temperature so that you have a more accurate measure, especially for the smaller ones that we're taking care of. So fever would be, by definition, 100.4 and above Fahrenheit or 38.0 degrees Celsius and above. Now, what happens to the body when one has a fever? Multiple things may be happening. One can see an increased heart rate, some increased breathing. Of course, sometimes you may see some perspiration. You may see some flushing of the skin. Usually, however, those symptoms do not cause distress for the person, but it is the body's physiological response to the elevated temperature. Now, a fever is not something that we have to fear just outright, but there are some basics that we need to keep in mind. Always make sure if there is an underlying condition or your infant, your child, your baby has a chronic medical issue, that you go ahead and seek the medical advice of your healthcare provider immediately. Because if there are underlying conditions that increase the risk for medical issues and there is a fever on top of this, it needs to be evaluated immediately. Also, as a physician, we go ahead and break down the fever into categories of age, as well as the high-risk category that I mentioned. By age, if an infant is under 3 months old and has a fever by rectum, you need to go ahead and bring that baby in to a medical provider immediately if that temperature is 100.4 plus and above. If the baby is over 3 months old and has a persistent temperature above 102 plus, you also need to take consideration of what is happening with the infant, but the risk is a little bit lower because the infant is now a little bit higher in age. And because of this, they have a little bit more immune reserves and resiliency than the infant under 3 months of age. If you ever see your infant or child looking very ill, having difficulty breathing, not feeding well, being very irritable or lethargic, as we might call it, meaning they are just listless, not wanting to be bothered, just outside of their normal behavior, you need to seek immediate medical attention. A fever in general, just based on temperature, is not a cause for concern if there are some obvious signs and symptoms that go along with it, especially as fever in children is often caused by a virus, which is normally self-resolving and not a cause for concern. Viruses are the most common cause of fevers in the pediatric population. It normally goes away on its own and is just treated supportively. Now, what could you do to help treat your child or infant supportively if there are no red flag signs? What can you do at home? You want to make sure that you keep them comfortable. Make sure you keep them well hydrated. Having a fever causes some water losses in general, some insensible losses, and because of that, there is a risk that your child or your infant can become a little bit dehydrated. So make sure that you're keeping them hydrated. If you have an infant and you're breastfeeding, continue doing so. That's one of the best things you can do to help to protect them and to help them fend off their particular infection as you pass on antibodies that help to guard them and get them through the illness faster. If they're formula feeding, you can still go ahead and do that as well. But if in either case, breastfeeding or formula fed in infants, if they are not taking their normal feedings, you can go ahead and supplement with some electrolyte solution such as Pedialyte, or you can even try some coconut water. Make sure whichever source you use, you try to make sure it is non-GMO and organic. Try and dress your baby lightly, comfortably, so that the clothing that they have on does not add on to the already increased temperature. You can also provide a tepid water bath, which means room temperature water that can also help to bring the temperature down and soothe the body as they fend off their current illness. There are some medications that can be given, which are fever reducers in infants and children. These, however, are medicines and they can have side effects, so we don't need to chase the fever with the medicine every time it comes up. What you can do is provide it only if your child or your infant is uncomfortable from the fever. Tylenol or acetaminophen can be used, but should always be used based on the directions and specific weight of your infant. Motrin can also be used, but only in infants 6 months and up. And even still, again, make sure that you use your medications wisely and only if needed. Check on your child individually. If they are playing and active, hydrating well, drinking well, doesn't have to be specifically eating all their normal amounts of food, but if they are keeping well hydrated, active, playful, doing okay, you can monitor them. You don't have to give the fever medications in these scenarios. There's also another category of children and infants that we need to be aware of, which are those that have febrile seizures. In those cases, check in with your medical provider and see how they would want to manage them, as they would be a little bit more higher risk for a return of a febrile seizure if they have had it before. And a febrile seizure is one that is caused by a sudden spike in the temperature that causes the seizure activity. Normally, it is benign, and this is something that you can specifically discuss with your healthcare provider. Again, individualize the care for your particular infant. So the key takeaways: age is a guiding factor as well as what we are looking like clinically and individually. If your infant is under 3 months old, immediately seek the medical attention of a medical provider or your pediatrician. If they are 3 months and above and they have a persistently elevated temperature, the risk is lower, but you should still keep a close contact to your medical provider, and you can go ahead and just call them and let them know what you're seeing and what's going on, or bring them in for an office visit. In these age ranges, you can treat supportively at home, as I discussed, but monitor for any progressive or worsening changes that may be pinpointing you to do a little bit more and seek that medical attention one-on-one. If your baby is not making good urine output, if they are markedly changed in their behavior, if they are not breathing comfortably, if they seem dehydrated, if they seem uncomfortable when you're holding them, if an older child seems to have a persistent headache that's not going away, or stiffness of their neck, or just a change again from their baseline and it's persistently so, seek immediate medical attention. So fevers can be treated at home in the specific situations as discussed, but always make sure you seek the medical attention of your specific provider because they know you and your child, they know the history, they know your background, and they can tailor the care according to your needs. So fever doesn't have to make you fear if you know some of these keys that you can keep with you if ever a fever were to unexpectedly strike, especially in those times when we are not prepared for them. If you have any questions, please leave them in the comments below. And as always, be well, and I will see you again next time.